Obamacare premiums set to spike up. Now the White House scrambling to tamp them down. An independent study showing a double-digit hike in premiums coming next year. So the White House urging states to do whatever they can to soften that blow. That includes doling out $22 million. Mike, you've warned about this. What do you think?
EMAC, Obamacare is a fraud. Bernie Madoff went to prison for doing the same thing with his stock investors. Unfortunately, Obama and Hillary Clinton both want to use stuff like this to give the government more power, more control over our health care. What we need to do instead is to eliminate Obamacare and start all over.
Jon Hartley, welcome to the show. What do you think?
Thanks for having me, Liz. Well, I think that this attempt won't really have any kind of meaningful impact. I think there are a lot more structural problems at play. I think it's important to remember how the Obamacare subsidies work. The government and the taxpayer will ultimately bear most of these costs and rising premiums. I think we've seen these types of warnings before. We've seen rising premiums in recent years. Add the fact that United Healthcare, which is the nation's largest insurance company, just announced in April that they're going to be leaving the exchanges. I think all of these signs point to instability in the health insurance premiums. And I think it really just points to signs for the need for reform.
Yeah, that's a good point. Now, Mark, here's what's going on. The $22 million is coming from the administration to, and you know this, to the state review boards, right? And the state review boards are the ones who say to the health insurers, look at no double-digit, no rate increases. They have the power to stop it. This seems like top-down stuff coming down from the White House. What do you think?
Well, I think the White House is trying to repair this. I think there's some real flaw with the exchanges, but going back to Mike's point, you have to put this into perspective. It's not a fraud. We had 47 million people who had no insurance in 2013. Now we have 17 million people, even with people having dropped out of the program, who have insurance. And yes, the premiums are way too high, and yes, there's subsidies, and there's some flaws in the way the payment mechanisms are. But Mike seems to suggest we should just say, forget it. You don't have insurance. Go live under a bridge. So this is a problem. I think it's a net gain. But yes, it is a problem. We have to come up with how to solve this cost problem and how to solve this exchange problem.
Sabrina, go ahead.
We have people who are now insured who were not insured.
Yeah, I hear your point. Sabrina, go ahead.
Well, no, look, I think that the problem is that Washington has a problem with meddling. It's like an addiction, but the more they meddle, the farther down the rabbit hole we all fall as consumers. And so right now we're seeing, for instance, that premiums are going up as expected. Another unintended consequence of their meddling is the fact that they just passed this overtime stipulation, which means that businesses are going to be forced to be paying higher wages. They're going to cut in other places, which we're seeing already is going to end up being in health care benefits. So people are going to be having higher premiums. Other people are going to be losing those health care benefits. This is just an example of Washington should get out of the business of health care.
John Tamny, here's what's going on. That $22 million is going to be coming down to the states, and the premium announcements, meaning the double-digit premium spikes in Obamacare premium costs, that could come in November, right before the election. Is this an attempt by the White House to tamp down a political backlash right around a presidential election, John Tamny?
Well, in trying to sell Obamacare in the first place, the administration was trying to convince us that 1 + 1 = 1,000. But what we're seeing right here very clearly is that markets always reflect reality. They promised a lot for nothing. Markets are saying that's not true. The Obama administration understandably wants to hide reality.
Yeah, let's bring Rich Karlgaard in here. Administration trying to hide the reality. Is the administration, the White House, trying to hide the true costs of Obamacare, Rich?
Well, they were doing that from the very beginning. Don't forget that Jonathan Gruber, the MIT researcher who is the architect of Obamacare, admitted that the administration had to fudge or lie about the numbers in order to get this thing through Congress. So it's always been flawed, and the administration has known it.
Yeah, and to Rich's point, Mike, Jonathan Gruber, that economist, said the American people are too, quote, too stupid to really see what's going on with Obamacare. What do you think?
Yeah, and despite what Mark says, my buddy, I think, paints me a little too evil. I really don't want people sleeping under bridges. Mark, we could have covered the costs of people that don't have insurance and given them enough insurance without forcing people like me to buy, tanning salon insurance or insurance for when I get pregnant.
But we haven't. And the fact is the private sector has failed. So we have the public sector. And I realize there's flaws in that.
You're making
but
one
the
big
private
mistake,
sector
my
has not
friend.
solved the problem.
Mark, I'm sorry for interrupting, but you're wrong. We did not have a free market prior to Obamacare. It was far from a free market. And what we had now is an even more regulated market.
Right. I think Mark agrees with that because he understands that Medicare and Medicare was, half the health insurance market already, right, Mike? But Jon Hartley, go ahead. You have the final word.
Well, I think that we do need some sort of kind of reform. We'll see if these premium increases continue in the next few years. In 2018, we're going to have the Cadillac tax come in, which is supposed to offset the fact that employer-sponsored insurance is already subsidized and given tax deductibility. I also think that there's a lot of interesting things happening in hospital consolidation, which is causing prices to rise. I think at the end of the day, we need some sort of reform plan that increases competition and brings some private market forces. I think that premium support, like in the plan brought forth by Paul Ryan, would do that.
And welcome aboard again, Jon Hartley. We knocked it out of the park, as the rest of the gang did. Thank you so much for a smart debate. The Cash and In gang getting ready to roll at the bottom of the hour. Eric, what do you got?
Hey, EMAC, just days before the Orlando terror attack, the DHS told employees not to use certain words like jihadist and Sharia. Is the administration being too PC? And is that putting all of us in danger? Plus, a big dilemma for parents as we approach the busy summer vacation season. Is the Disney Gator attack making them think twice about going to Disney? See you at 11:30.
Thanks, Eric. We will be watching. But up here first, talk about making the grade. The government just ranking nearly all federal workers as, quote, fully successful or above. Why that may mean we'll never succeed in cutting government waste.